My name is Autumn Knight, and today I'm going to be doing my drug and fact display. So can anyone guess this drug? And the answer is Depressants, morphine. So morphine is the common name. It also has a scientific name, which is very long. I'm not going to try to pronounce that. It also has street names such as Dreamer, M-Cell, First Line, God's Drug, Howes, MS, Mr. Blue, Morpho, and Unky. And some common brand names are Cadian, MS Contin, Oromorph SR, MSIR, RMS, and Roxanol. So question 1, which is not a street name for morphine? Dreamer, Mr. Blue, Candy, or God's Drug? And the answer is Candy. Question 2, which is not a brand name of morphine? Tylenol, Roxanol, Cadian, or RMS? And the answer is Tylenol. So what is morphine? Morphine is an opioid drug that is derived from the poppy plant to treat moderate to severe pain. This drug exhibits depressant qualities due to its sedative effects on an individual. There's many forms and ways to administer morphine into the body. The first way is through a tablet, which can come in two forms: a rapid release, which is taken every 4 hours, or an extended release, which is taken every 12 hours. And as you can see from the picture, the color may vary depending on the brand and also the amount of dosage. So next is an oral solution. This is for people who have low consciousness or are either on palliative care. It is effective within 15 minutes and it lasts up to 4 hours. And this can also be an alternative for people who are not able to swallow a tablet. And then next is the most common way you'll probably see morphine administered in health facilities, which is through injection. And this can be either intramuscular, subcutaneous, or intravenous. And then lastly is through a suppository, which is mainly used when the dosage needs to be spread out over a long duration of time. So question 3, true or false, morphine derived from the poppy plant? Question 4, what is a way morphine can be administered into the body? And the answer for question 3 is true. And the answer for question 4 is all of the above. So morphine is an illegal drug, and it falls under the Schedule II classification according to the DEA. And to your right, I have highlighted a chart from the website where it classifies morphine as a Schedule II drug. Although this drug is classified as illegal, it is still used by healthcare professionals in medicine. And Schedule II is actually the highest scheduling of drugs that can be used in medicine because of its high level of addictiveness. Question number 5. What is the schedule of morphine? And the answer is Schedule II. So some history of morphine. Morphine was discovered by Friedrich Wilhelm Adam Serturner in 1803 while working as a pharmacist assistant. There is a picture above of him. And in 1806, Serturner performed an experiment using the gum of the poppy plant and an alkaloid compound. It was then when he realized that the alkaloid was much more powerful than the opium from the poppy plant. So he then named this substance Morpheus after the Greek god of dreams for the substance's sedative properties. In 1818, French physician François Megandy published a paper that described how morphine brings pain relief and sedation to individuals. By the mid-1820s, morphine was widely available in Western Europe in standardized doses from several sources, including the Darmstadt Chemical Company, started by Heinrich Emil Merck. In 1853, the hypodermic needle was developed, which you can see slightly in the background of this slide. And the use of morphine after this invention became very widespread. Morphine has now evolved since then with many forms and ways of administration. By the 1870s, the awareness of morphine's addictive properties were known. And in December of 1914, the United States Congress passed the Harrison Narcotics Act, which demanded control of each phase of the preparation and distribution of medicinal opium, morphine, and any other substance that resulted in similar properties, making possession illegal. In 1970, the Federal Controlled Substances Act lists opium and any substance made from the poppy plant and all parts of the plant except the seed as a Schedule II controlled substance. Today, morphine is still used for medical purposes and abuse of the drug has increased. Question 6. When was morphine discovered? And question 7. When was morphine classified illegal for possession? And the answer to question 6 is 1803. And the answer to question 7 is 1970. So why do individuals abuse this drug? According to the National Institute on Drug Abuse, morphine binds to opioid receptors in a part of the brain which is called the reward circuitry, as well as to parts of pathways related to pain sensations, producing analgesic effects. Neurotransmitters such as dopamine are released, triggering sensations of pleasantness. And when individuals repeat whatever act that causes the sensation of pleasantness, it forms a reward pathway inside the brain. Morphine then disrupts this natural process by creating large amounts of dopamine that take over the brain, creating euphoria. So some ways that people can access morphine. The most common way is through prescriptions, which is known as doctor shopping. And doctor shopping is just when an individual will go to multiple doctors and try to get them to prescribe a certain drug to them over and over until they can get enough that they can have a large supply that they can abuse. And then also people can find this on the street. Although it is more expensive than other drugs, you can still find this on the street through people that do acquire the drug. And then also through family and friends. Like I said, you can get it as a prescription. So many people might get their family or their friends to give them, their unfinished prescription of morphine. So question number 8, true or false? Doctor shopping is the act of visiting several doctors to receive a drug in multiple amounts to abuse. The answer is true. So here I've inserted a table, and this is from 2012 to 2013. And this is just listing the non-medical use of morphine, or you could say any type of prescriptions that were used by people that were 12 years or older in the past year and the past month and throughout their lifetime. So for the lifetime, you can see that there was a total of 765 in 2012 and 785 in 2013. And then for age, you can see that the people who used it the most was 26 years or older. And then for gender, it was almost cut even, half and half. And then for Hispanic origin and race, it was people who were not Hispanic or Latino. And then here I've inserted just a picture that I found on the CDC website. And it said that nearly 450,000 people died from an opioid overdose between 1999 and 2018. And then in 1990, it was a rise in prescription opioid overdose deaths. In 2010, it was a rise in heroin overdose deaths. And in 2013, it was a rise in synthetic opioid overdose deaths. And then here is another chart from the CDC website, and this is just showing the overdose death rates involving opioids between 1999 and 2018. So as you can see, for the most recent in 2018, there was basically any opioid was causing very high death rates. And then going from that, synthetic opioids, prescribed opioids, and then heroin at the lowest amount. And then this is a chart that I found about the different types of people based on their age, race, sex, education, employment status, poverty, and veteran that are susceptible to chronic pain or high impact chronic pain. And then this is a table from the National Survey on Drug Use and Health from 2018. And you can see that in 2018, that opioids were at 10,250. Also, the American Society of Addiction Medicine reported in 2016 that of the 20.5 million Americans suffering from an addiction disorder that year, that 2 million of them suffered from an addiction to prescription painkillers like morphine. And then question 9, out of 20.5 million individuals suffering from addiction, how many of those individuals suffer from addiction caused by painkillers? And the answer is 2 million. So some financial impacts on morphine. Chronic pain affected approximately 100 million people in the United States in 2011 and was associated with economic consequences ranging from 560 billion to 635 billion annually in medical care and decreased productivity, underscoring the need for more effective pain management strategies. According to the NIDA, drug addiction and substance abuse cost the United States more than $600 billion each year. Also, according to the NIDA in 2018, every dollar invested in addiction treatment programs yields a range of between $4 and $7 in reduced drug-related crime, criminal justice costs, and death. Administration of 120 milligrams of morphine per day to hospitalized patients for 30 days would have a total cost of $155.40, using a regimen of 60 milligrams extended-release morphine 12 hourly. In contrast, total costs for a 30-day regimen of 20 milligrams morphine solution 4 hourly would be $320.40. And then here I've highlighted on this chart, this is just showing the average monthly cost of analgesic drugs. And you can see for morphine pills, it lists some of the common brand names. And then the frequency of how many uses per day, the total dosage per day, and then the average monthly cost. So the average cost for a 60-tablet extended release of morphine, which is 15 milligrams each of just the generic morphine sulfate ER, is $67.99. All these prices vary on location depending on where you live and also what store or pharmacy you're buying it from. And I've listed a website where I actually found a whole bunch of the prices for morphine, and it was surprising to me that these websites also had coupons on there to reduce the price of morphine. And then profit for distributors. There's $81.6 billion in sales that Johnson & Johnson reported in 2018, and many distributors such as Johnson & Johnson have been fined for the target of sales to hospitals, physicians, and other healthcare facilities with the most recorded pain-related admission, and this was leading to an increase in the opioid addiction. And then here I've listed some positive and negative effects of morphine on the body and mind. Some positive effects is pain relief, rest, and relaxation. The negative short-term effects are constipation, vomiting, drowsiness, loss of appetite, rashes, twitching, nausea, blurred vision, itching, dizziness, sleepiness, headache, poor coordination, and confusion. And then negative long-term effects is loss of interest in family, friends, and work. You develop financial problems as a result of spending to get the drug. and then stealing from others, and an increase in criminal activity, depressed breathing, memory problems, irregular menstrual cycles, anxiety, severe constipation, chronic sleep disturbances, loss of sex drive, impaired muscle coordination, kidney failure, decreased metabolism, physical weakness, and uncontrollable eye movements. So you can see that there is a lot of negative short-term and long-term effects, and I did not find any positive long-term or short-term effects, just besides the pain relief, rest, and relaxation. And then I've also inserted just a chart giving a general overview of how morphine affects your behavior, your body responses, your brain, your general health, your psychology, sex and sexuality, and other serious adverse side effects. So another question, which is not a long-term effect of morphine abuse? And the answer is brain cancer. So some effects on society. Morphine affects society by the loss of interest in personal relationships with your family and friends, an increased crime in the community, an increased need for medical attention due to overdoses, environmental factors when unused drugs enter elimination facilities, such as when people are flushing prescriptions down the toilet, and then an increase in trauma in young children of caregivers who abuse the drug. And then overdose and withdrawal of morphine. Some signs of an overdose of morphine are uncontrolled vomiting, breathing difficulties or respiratory arrest, bradycardia, which is just slowed heartbeat, or cardiac arrest, convulsions, which is just rapid twitching of muscles. Many people just refer this as seizures, and then loss of consciousness. And then once you go into the withdrawal stage, you have symptoms such as extreme drug cravings, anxiety, irritability, sweating, runny nose, diarrhea, decreased appetite, cramping, vomiting, and chills. And then I've inserted just another chart of duration of the withdrawal of morphine. It tells you what stages and symptoms that you're going to experience within 1 to 3 days, 3 to 5 days, 5 to 7 days, and 2 weeks. And then also showing the post-acute withdrawal syndrome, which is also referred to as PAWS. And these symptoms can happen anywhere from months after you quit abusing the drugs or years. And then when you're on your road to recovery, you can go through a medical detox, which is basically just when you have stopped abusing the drug and you're in some type of healthcare facility and you're being offered medicine that will help control those withdrawal symptoms that you're going to experience. And then also inpatient and outpatient rehabs. Inpatient rehabs offer a lot of support from your peers that are going through the same thing. And then if you don't prefer that, you can just do outpatient, which is mainly in the home. And then also there is a bunch of online counseling, such as hotlines or online chats. And then also just reaching out to your family and friends. So conclusion, a little bit of a fun fact that I found was interesting besides the rest of the things that you've learned about morphine so far was opium from the poppy plant that derives drugs such as morphine has been used for over 6,000 years now. And I just think that that is crazy that, you know, this drug has developed and derived so many other drugs from that. And then these are all of my references. And thank you for watching, and I hope you learned a little bit about morphine.